We also have a lab as part of the practice, which is very convenient for the patients because they can have their physical and then proceed directly to the lab, get their labs drawn, or some patients choose to have their labs done before their annual physical and they're ready. We have the results and we can talk about it at that time. The lab is also helpful for other doctors who are in this area, which there's quite a few because we're centered around a nearby hospital, and they can send their patients here to have their blood drawn and sent to their doctor from our lab, or the blood work can be sent to an outside lab from our lab and then sent to their doctor. So it's very, very convenient. And we can also do all the basic blood tests here. If something needs to be done stat, we need the results right away. The lab's right here. Patients don't have to go anywhere. Especially if we think the patient's not very stable, it's better than sending them down to the lab down the road, or if they're not so unstable, we don't think they're going to need to go to the emergency room. It's so convenient to have the lab here, and then we have an answer. We can make a disposition on what to do with the patient depending on what the results are.
Because of the diabetes, I have to have lab work done. I mean, the lab's right here. I don't have to go all over the place and then have them wait for the laboratory results. They're right next door. So it's been very convenient for me, to have these diagnostic testings and the lab work and now the prescriptions just to be in one place. It's like a one-shop mall.
Common tests that we do here, we do a CBC, which is a study with blood. We also do cholesterol panels, hepatic panels, liver function tests. We also do thyroid panels and also PSAs for gentlemen.
One of the other areas that we're particularly sensitive to is making certain that once diagnostic tests are ordered or there's a prescription for medication, that patients are able to follow through in a way that's most convenient for them. We have found that patient compliance goes way up if testing is convenient or if picking up medication at our office is available to them. Statistically, I believe that it's been shown that maybe 3 out of 5 people may go get diagnostic testing ordered by a physician if they have to leave the doctor's office and go to a freestanding facility. Similar statistics actually apply to the pharmacy situation as well. I believe that what we've created here is sort of a medical supercenter in that patients can see their physician, get their medications refilled, and have their diagnostic tests, including laboratory testing, all done in one place.
Well, I have several issues, as I said. I am diabetic, type 2 diabetic, and so I'm on medication. I take oral medication and a special diet. And so those things have to be tested daily, but also I come in for blood work, extensive blood work every 3 months, which covers what the disease itself is doing as well as the medications I'm taking for that disease. The fact that she can monitor all of the things that are wrong with me, and if something does seem out of whack a little bit, she'll send me to that specialist that I see for that. But for the most part, I can take care of all of the examinations that I need right here.